Welcome to Colombia Care. My name is Nicholas, and a little more than 2 weeks ago, I undergo the surgery ARTAS for 2,000 grafts at our clinic with Dr. Maldonado. Please follow me on this journey with Colombia Care.
The first stop is at Dr. Maldonado office to go one last time over the procedures, answer any questions
You say
left
you
over.
want to cover a little bit this hole in the belly, yeah?
Exactly. The idea is to close. You see, like here, the hairline to have it seem more normal. This side is okay. This one is worse, but the other is like.
Okay, now we are going to do the design.
And with the information you gave us, Dr. Maldonado will be able to tell you what is possible, what is not, how it's going to be done, at what time, all the timeline of the surgeries, from the extraction of ARTAS to the lunchtime to when we put the grafts back, what time you're coming back tomorrow, why you should come, any question you might have regarding the post-operation, how the follicles are transplanted, why do we extract with plasma. All this is covered during that nice session. And then we go right to the measurements and drawing the hairline when it's for the frontal area. I got to get the little bathroom mask for a minute so he can point the dots and then draw the future hairline.
Yeah, we are going to fill this area.
We fill this
This
area.
frontal recess. It's more in this area. It's huge. It's a huge area. Yeah, of course.
Yeah, I don't know why, but like I have a recess here.
Yeah.
But not too much on the top. But all my family is like that, but it doesn't go more.
Now we're doing the photos for the before and after, so hopefully almost I can do. Should I should look sad because I don't have hair, right? To do the first picture of it.
BFF. Then Dr. Maldonado will write a prescription for the routine blood test for the surgery coming up tomorrow.
Good morning. So I'm having the hair transplant in like 30 minutes. So right now what we're doing is that they're extracting what's called the plasma, which is a part of my blood. And that's where we're gonna hold the graft when they're away from my body, so that they're most likely to survive. So it's a little thing we do on top of it. Everything is you keep the graft in your own plasma. And that really like increase the survival rate in the graft. So and it's really quick, it's been like 5 minutes and it's on the picture. So right now I'm gonna get my hair cut. So basically we're gonna shave the back of the head, or as the donor area situated.
Okay, Nicolas, now I'm going to do the design in the donor area.
Okay. The donor area is where you're gonna extract with the ARTAS, the grafts, right?
Yeah. Here is the area we are going to shave.
That's part gonna be shaved so that the robot can access the graft like this.
Not my best haircut, but I had worse barbers, to be honest. One solution is to go to the barber the day prior and you have a better result. Now we're planning some dyeing to my hair because I'm blonde, so that the robot can see them better. And then the little last shower, it is cold. You can see it on my face. I'm pretending right now. They draw the last hairline. Check. Do I look pretty? Yes, I like it. Now, you can see on my face, I know it's getting real. It's time for ARTAS.
So right now I'm on the ARTAS. What we're gonna do is like we're gonna draw the hairline, see how it's gonna find, and then we're gonna start extraction. So the extraction procedure is like 3 to 4 hours. As you can see, the painting my hairs in the back because I'm blonde. So I just put the robot to have a better idea to where to get the grafts. Juan Carlos, are you ready?
Yeah.
So I'm excited, and we'll see how the hairline goes from now. We have the whole medical team. Everybody's ready.
You have a lot of
I'm like, yeah, I have a big team with me.
It's like a laundry in a motorcycle.
Alright.
Then put your head here. You want to feel comfortable. Okay. I'm going to move the shade. Okay. I'm going to do the anesthesia.
The anesthesia part is actually the worst part. Like you can feel the needle going to the skin, but it really quickly fades away with the application of the product.
This is the worst part of the procedure.
Oh yeah?
Yeah.
Oh, well, fine.
Fine?
Yeah.
I don't think so. Not fine. Maybe feel pain, but not fine.
Even Dr. Maldonado knew I was not that brave. Now, what is strapped to my head is actually the ARTAS detector. This is the zone predefined by the robot where the extraction gonna start. So it looks pretty impressive. You can see the machine coming and scouting the zone more likely. You have Dr. ready with his little tool to pick up the follicles once the perforation is done by the machine. So you can see it punctured, they pick up the follicle, they go right into my plasma little jar to be transplanted later. This is the longest process. Honestly, it's almost painless because you had the anesthesia, but I recommend you go with little headphones and you get ready for a long ride of 4, 5 to 6 hours depending how many grafts you need. You can see on the little screen here that the blue dots are actually the algorithm spotting the most healthiest graft. Another part that is great about ARTAS is that it's going to spread the extraction all over my scalp and in an even way for the 2000 grafts.
Right now we are on the last process stage of the process of hair transplant, which is basically transplanting in the wanted area the grafts. So we harvested them, then we had them all together with our plasma, and now they're being transplanted by one in the desired area. Honestly, this is the easiest part of the process, as the extraction. You have to be seated in the robot with the punctures. Right now, it's painless. I have local anesthesia, and we have a great team. We get it at work so that it goes fast. I have TV, so things are good so far. I'll see you later.
In this footage, you can see the assistant applying the follicle on the applicator that is directly transplanted into the one that's placed. The applicator we use are very convenient because they really let us determine the depth and the inclination of each follicle following Dr. Maldonado's instructions. On day 2, we will receive you again at the clinic to get you a cleaning of your head, take off the bandage on the donor area, and check if all the grafts are well placed. And on top of that, we will process with a short 30 minutes laser therapy that is complimentary from our services, and that really improves the general healing of the scalp and the donor area. Thank you so much for watching this video. I truly hope that it helped you give a better understanding of ARTAS and its procedure. We really did our best to shoot from the beginning to the end, going through all the stages. Another main goal from this video is to show you that even though we're in Medellin in Colombia, the quality of the service, the advanced facilities and qualified medical team make us very competitive with the world market, with a pricing that can be more interesting that you would find in the States or Europe. These footage are from 2 weeks later. All the scab fell off. You can see the little hair growing already. These hair will eventually shed in the following weeks to grow back stronger, and 3 to 4 months. I can't wait. And the definitive result from months 8 to 12, even though it can take up to 18 depending on the patient. And the donor area is perfect. Like I'm very blonde, and this has been 2 weeks, and you can see no noticeable mark of ARTAS extraction because all the punctures were spreaded evenly. Thanks for watching. Please visit our webpage and feel free to contact us to let us help you on your next goals.